Contact tracing is a very classic tool that epidemiologists use to identify outbreaks and then identify sick individuals or, people that may be infected with a particular disease, in this case, COVID-19.
Contact tracing really grew mostly out of looking for the solutions to sexually transmitted disease outbreaks. And so basically, once someone was diagnosed, or as epidemiologists would say, becomes a case, then we would ask them for all of their partners or all the people that they may have exposed, and then we would offer them treatment. In this case, we're looking for anyone who's become a case of COVID, and then we're asking them to give us a list of anyone that they may have had close contact with. Then each of those people would be contacted to determine who they had close contact with, and then again to monitor them for a period of time so that we can stop community transmission of COVID.
It's really a low-cost, low-tech process. Generally, we call up the individual and interview them to see what their activities have been over the last period of time, see where they've been, have they been working, did they work sick, because generally if someone's infected, it stands to reason there's a good likelihood that they have the ability to infect others.
One of the things that makes COVID-19 so much more complicated is the fact that it is spread through individuals without symptoms. On average, an infected person is infecting about 2 to 3 people. Now, we are seeing some cases where it's even more than that with more direct contact. So it's easy to see from a mathematical perspective how this infection can just increase so dramatically in a community if every one person infected spreads it to at least 2 or 3 more people.
We are trying to focus on those high-risk individuals, the highly sensitive settings, such as like healthcare workers, first responders, those in long-term care facilities, those that work in industry where they're basically shoulder to shoulder in like assembly line type settings, so that we can target those high-risk areas.
Until we have treatment and vaccine, contact tracing is going to be one of the most important tools we have in public health to help keep this infection contained.